I want to tell you about a patient named Brenda. Brenda is 72. She is diligent. She walks every morning. She watches her salt intake, and she takes her lisinopril for high blood pressure every single day at 8 a.m. For years, her blood pressure was perfect, 120/80. But then last winter she came in for a checkup, and her numbers were shocking, 160/95. We thought maybe the machine was broken. We checked it again, 162/96. Brenda was terrified. She asked, "Doctor, is my heart failing? Do I need more medication?" We almost doubled her prescription. But then I asked her the most important question a doctor can ask. "Brenda, have you started taking anything new? Anything from the health food store? Anything for energy or digestion?" She pulled a small bottle out of her purse. It was a root extract she started taking for her stomach. That root was the culprit. It wasn't stress. It wasn't salt. It was a natural supplement that acts almost exactly like a steroid in the body. Hello, I'm Dr. Smith, and today we are solving the mystery of resistant hypertension. If you are over 60 and your blood pressure is creeping up despite diet and medication, the answer might not be in your prescription bottle. It might be in your supplement drawer. We are going to cover the top 6 supplements that are secretly sabotaging your heart health. These are products sold over the counter without warnings that can constrict your blood vessels and fight against your heart medication. If you are fighting to keep your numbers down, you cannot afford to miss this list. Let's protect your heart. Quickly, before we dive in, I am a doctor, but I am not your doctor. This video is for educational purposes. High blood pressure is serious. Never stop your prescribed heart medication, and never stop or start a supplement regimen without showing the bottle to your own primary care physician. We are a team in your health, but your own doctor is the captain. The physiology. Why senior arteries are different. To understand why these supplements are dangerous, we have to talk about physics. Imagine a garden hose. When it's new, it's rubbery and flexible. If you turn the water up, the hose expands to handle the pressure. That is your aorta at age 25. But as we age, our arteries undergo a process called arteriosclerosis, hardening of the arteries. This is natural. The hose turns into a stiff pipe. It loses that elasticity. This means your body loses its buffer zone. If you take a stimulant at age 25, your arteries stretch to accommodate the blood flow. If you take that same stimulant at age 65, the arteries cannot stretch. So the pressure inside rockets upward. This is why a supplement that is safe for your 30-year-old son can be dangerous for you. Furthermore, many of you are on medications like calcium channel blockers or ACE inhibitors. Some of the supplements on this list don't just raise blood pressure directly. They essentially cancel out your life-saving medication, leaving you unprotected. Let's look at culprit number 1. It is the most potent, most common, and most dangerous item on this list. Culprit 1. Licorice root, the natural steroid. Number 1 is licorice root. And no, I don't mean the red candy twists, which are usually just sugar and flavoring. I mean real herbal licorice root, Glycyrrhiza glabra. Seniors often take this for heartburn, acid reflux, or a persistent cough. It is incredibly effective for soothing the stomach. But here is the trap. Licorice contains a compound called glycyrrhizic acid. When you ingest this, your body mistakes it for a hormone called aldosterone. Aldosterone is the hormone that tells your kidneys to hold on to water and salt. When you take licorice, you are flooding your body with fake aldosterone. Your kidneys stop peeing out sodium. They start hoarding water. Your blood volume expands. Remember the stiff pipe analogy? You are now pumping more fluid through that stiff pipe. Your potassium levels drop, hypokalemia, and your blood pressure skyrockets. I have seen patients end up in the ER with hypertensive urgency, blood pressure over 180/110, solely because they were drinking licorice tea every day for their stomach. The action plan. Check your labels. Look for licorice root extract in your digestive aids. The swap. If you need it for your stomach, look for DGL, deglycyrrhizated licorice. This is licorice that has had the dangerous heart-raising compound removed. It soothes the stomach without spiking the pressure. DGL is safe. Regular licorice is not. Culprit 2. Ginseng, the energy trap. Number 2 is the world's most famous energy booster, ginseng. Specifically, Asian ginseng, Panax ginseng, and Siberian ginseng. As we get older, energy levels dip. It's natural to reach for something natural to give you a lift. Ginseng is marketed as the fountain of youth. But ginseng is a stimulant. It works on the central nervous system. For many people, it can cause what we call ginseng abuse syndrome, a combination of sleeplessness, anxiety, and hypertension. While the science is mixed, some studies say it lowers BP, some say it raises it, the clinical reality for seniors is risk. Ginseng can interact with blood thinners like warfarin, and in sensitive individuals it causes vasoconstriction, tightening of the blood vessels. If you are already taking medication to relax your blood vessels and you take a pill that tightens them, you are starting a war inside your body. The action plan. If you have uncontrolled blood pressure, ginseng is a gamble you shouldn't take. The swap. If you need energy, look at CoQ10, coenzyme Q10. It supports cellular energy, is generally heart-safe, and can actually help lower blood pressure slightly. It's a much smarter choice for the senior heart. Culprit 3. St. John's wort, the medication eraser. Number 3 is tricky. It doesn't always raise blood pressure directly, but it causes hypertension by sabotaging your medication. This is St. John's wort. Many seniors take this for mild depression or low mood. It works well for that. However, St. John's wort is what we call a potent inducer of CYP3A4. I know that sounds like a robot name, but it's an enzyme in your liver. This enzyme chews up medications. When you take St. John's wort, you put that enzyme into hyperdrive. It starts chewing up everything in sight. If you are taking a calcium channel blocker, like amlodipine or nifedipine, or a beta blocker to control your blood pressure, St. John's wort will chew it up and spit it out before it can work. You take your BP pill, but because of the St. John's wort, your body metabolizes it so fast that it's like you never took it at all. This leads to rebound hypertension. The action plan. If you are on any prescription medication, blood pressure, blood thinners, statins, St. John's wort is strictly off limits unless approved by a pharmacist. The interactions are too numerous. The swap. For mood support, discuss safe options like therapy, vitamin D, or specific prescription SSRIs that don't mess with your heart meds. Culprit 4. Yohimbe, the dangerous vitality booster. Number 4 is often hidden in supplements marketed for men's health or vitality, yohimbe or yohimbine. This is derived from the bark of an African tree. It is used to treat sexual dysfunction and low libido. How does it work? It is a potent alpha-2 antagonist. Without getting too technical, it increases the release of norepinephrine, essentially adrenaline. It forces your heart to beat harder and faster, and it clamps down your blood vessels to increase pressure. In a 25-year-old athlete, this might cause the jitters. In a 70-year-old with stiff arteries, this can trigger a hypertensive crisis or an arrhythmia, irregular heartbeat. I have seen products labeled simply as male virility blend that contain high doses of yohimbe. The user didn't even know they were taking a stimulant. The action plan. Turn your bottle around. Look at the proprietary blend. If you see yohimbe or posnastalia yohimbe, and you have high blood pressure, throw it away. The swap. For sexual health, L-citrulline or beetroot powder can improve blood flow by relaxing vessels, increasing nitric oxide. rather than forcing them open with adrenaline. Much safer. Culprit 5. Arnica. The poison is in the dose. Number 5 is arnica. Now wait, I know many of you have arnica cream in your cabinet for bruises and arthritis. Arnica cream, topical, is fine. It stays on the skin. I am talking about oral arnica, taking the pills. In homeopathic medicine, the doses are so small they are usually safe. But in herbal medicine, taking whole arnica plant extracts internally is toxic. It raises blood pressure, damages the heart muscle, and can be fatal in high doses. The confusion happens because people assume if the cream is good for my pain, the pill must be better. No. Arnica is cardiotoxic when ingested in significant amounts. It irritates the digestive tract and stresses the cardiovascular system. The action plan: keep the cream. Rub it on your knees. It works. But do not swallow arnica unless it is a highly diluted homeopathic pellet prescribed by a professional. Never take herbal arnica capsules. The swap. For arthritis pain, look into curcumin, turmeric, or boswellia. These fight inflammation systemically without poisoning the heart. Culprit 6. Sodium-rich effervescence, the hidden salt bomb. Number 6 isn't a plant, it's a delivery system. I'm talking about effervescent vitamins, the fizzy tablets you drop in water. Vitamin C fizz, magnesium fizz, electrolyte fizz. Seniors love these because they are easy to swallow. But how do they get the fizz? They use sodium bicarbonate, baking soda. A single tablet of effervescent vitamin C can contain nearly 1,000 millimoles of sodium. The American Heart Association recommends an ideal limit of 1,500 millimoles of sodium for the entire day for seniors with high blood pressure. If you take 2 fizzy tablets a day, you have blown your entire salt budget before you've eaten a single piece of food. This is stealth sodium. You think you are getting healthy vitamins, but you are drinking a salt lick. This causes fluid retention and immediately raises blood pressure. The action plan. Read the supplement facts panel. Look at the sodium line. It should be near zero. If it says 300 millimoles, 500 millimoles, or 800 millimoles per tablet, switch to a capsule. The swap. Swallow the pill. Or use a powder that doesn't fizz. Don't let your vitamins be the reason you need more blood pressure medication. Conclusion. The safety first protocol. I know this can feel overwhelming. You're trying to do the right thing, and it feels like there are landmines everywhere. But knowledge is power. By knowing these 6 culprits, you are already safer than 90% of the population. Here is your homework for today. The cabinet audit. Go through your supplements. Look for licorice, ginseng, yohimbe, and St. John's wort. The salt check. Check your fizzy vitamins for sodium content. The conversation. If you find these items, don't panic. Just stop taking them and monitor your blood pressure for a week. See if the numbers come down. And remember Brenda? The patient I mentioned at the start? She stopped the licorice root. Within 10 days, her blood pressure was back to 125/82. She didn't need more pills. She just needed to stop the natural poison. Your body is resilient. Give it the right environment, and it will thrive. If you found this helpful, please subscribe and share this with anyone you love who has high blood pressure. Let's keep those hearts beating strong.